My name is Majella Doyle. I work at Washington University in St. Louis, and I do transplant surgery and hepatobiliary surgery in both adults and kids. So basically the bottom line is we take your liver out and we put a new liver in. That's the bottom line. The liver that we all have has 2 blood vessel connections going into it and a bile duct draining bile. And then the liver drains blood back into the heart. And so we have to reconnect all of those connections with the new liver. So we connect an artery, a vein, and a bile duct. We want you to be just as you were before you got sick with your liver disease. That's the aim of liver transplant. And that's the most incredible thing about transplant. When you look at patients who are in the hospital for many, many other reasons, heart disease, all those kind of things, they are sick and they're getting treatment. But patients who come in for transplant, they are having a total transformation of their complete sickness to wellness. It's an incredible transformation, and to see a patient who comes in, sometimes on death's door. I mean, they are very, very sick patients, and the next day you go to talk to them and they are like, they may still look jaundiced and they may still be in the ICU, but they will say to you, my brain just turned back on. It's the most incredible thing to see a liver that you take out of a person, you put it on ice for a few hours, and then you put it into another human, and it starts to work. And in front of our eyes, it starts to make bile, which is like the main, what we want to see, the liver working. And the patients then have this reaction the next day. It's really incredible. Well, I think there's a few approaches. You want to kind of know a little bit about the program and who are the surgeons who are going to be operating on you. So I think it's reasonable to ask, how many liver transplants do you do? How often do you do them? And it's also a very good question to ask your doctor, what questions should I be asking? I find a lot of patients ask me that, and I think it's a very thoughtful question. I think you need to ask what kind of complications am I going to have? How will the medicines, the anti-rejection medicines, affect me in the long term and in the short term? How many medicines am I going to be on? How am I going to remember to take them? How am I going to manage when I go home? How am I going to know if my liver's working? The team that's looking after you when you have a liver transplant is very widespread, and so you usually at most centres you have a nurse coordinator who is looking after you, and they're the kind of your primary contact person. And but when you go to clinic, you're going to meet multiple different people, including social work, hepatology, surgery, and so you can amass your questions together and ask all of them, if you like, at the one sitting. But the different doctors and people that you see may direct you to other people to answer different questions. But I think that's about the height of it. You want to know the complications and the long-term outcome. And most importantly, how long is my liver going to last? And, is it going to last me the rest of my life? I think you, first of all, need to understand that if the transplant goes smoothly and no issues occur in the recovery period, a lot of patients, depending on how sick you are when you're getting your liver transplant, some patients will be in the hospital for as short a time as 4 days, and some patients, of course, may be in the hospital longer if they're coming into transplant sicker. I think we take the approach with all of our patients that in the long term that we would like them to have the idea that they can get back to not where they are now, but where they were before they ever got sick from their liver disease. So we want them to get back to a completely normal life, whether that's back to work, whether that's back to climbing mountains, picking up your hobbies again, doing whatever you want to do. So we believe that you should be able to get back to baseline, to where you were before you were ever sick. Now, of course, there may be humps along the way, and you may have complications, you may have bleeding, you may have bile leak, you may have episodes of rejection, you may even need another liver transplant. But most things that we come across are surmountable and fixable, and no matter how sick you are going into your liver transplant, we believe that everybody has the potential, or we wouldn't be doing the procedure, to have a fantastic outcome and have a long life with their liver transplant afterwards. Interestingly, in the past, hepatitis C was by far the most common reason for a liver transplant, but now there have been the development of amazing drugs over the last few years that cure hepatitis C, and so the number of patients who get transplanted for hepatitis C is going down. We still do transplant for hepatitis C, but less so. We transplant a little bit more commonly. Again, in the States, obesity has become a problem, and so patients develop fatty liver disease, and that's on the rise as a reason for transplant. There are some other disorders of the bile duct that you can develop throughout life, some autoimmune diseases that can require transplant, and then we transplant a lot for some cancers too. Some primary liver cancers such as hepatocellular carcinoma and cholangiocarcinoma are the two main cancers that we transplant for. And then there's a few others that we transplant for as well. And then there's, of course, some patients who we don't even know what's wrong with their liver. They develop cirrhosis and need a liver transplant, and we don't know the cause. And then, of course, I forgot alcohol. There's definitely still a considerable percentage of patients who have a background of alcohol excess. So the evaluation takes about 2 days, at least at our centre. You come in and you see a whole host of people. Over the 2 days, you have a bunch of investigations, scans of your belly, scans of your chest. You have testing on your heart, testing on your lungs, all with the aim to make sure that you're fit enough for this big operation. When you see the doctors, they'll explain, particularly the surgeons, they'll explain the procedure and the complications and the risks and benefits. They'll also talk about donors, potentially living donors, and the various different types of deceased donors. And these are all very important things for the patients to understand. We always advise that the patients come with their social support, the people who are going to help take care of them after the surgery, because a lot of the times when you're in the clinic, you only get 30% of the information maybe. So it's really helpful to bring somebody with you. Having said that, for any patients who are in clinic, they'll hear the same information over and over again from multiple people. Plus there's paperwork, there's classes. At our centre, we have patients meet with mentors, in other words, patients who've had previous liver transplants so they can understand what to expect. And we certainly don't introduce them to just patients who haven't had complications, because we want them to understand the full picture. And then after transplant, at our centre at least, if you live more than 2 hours away, we ask that you stay in town for a couple of weeks after the transplant. If you can't afford like a regular hotel, there's lots of support and ways to have places to stay that are close to the hospital. But we do need you to kind of stay within an hour of the facility, because that's the time when the readmission rates are the highest. And then once that time has passed, you can go home. Now, we do have some patients who come from much farther afield, and sometimes they have to stay a little bit longer. But once you go home, it's really just a question of organising your medicines so that you make sure that you remember to take your medicines twice a day. And we see you a lot in clinic for the first few months, once, at least twice, 3 times a month. For the first month, and then maybe it's every 3 weeks, every 4 weeks, and then it gets pushed out at 6 months to every 3 months, and then you move to every 6 months, and then you move to every year. And so the farther away you get from the transplant, the less often you have to come to clinic. But you do get lots of checks on your blood tests, because we want to make sure that your liver's functioning okay, that we don't need to do anything. And of course, you may end up coming back to the hospital for some investigations, or for a liver biopsy, or for scans, depending on any abnormalities that we see in the lab test. So we do keep a very close eye on the patients particularly for the first 6 months.